The real challenge that we have today, not just because of the recent elections, but because of the reality of where the economy is how to really focus like a laser beam, using a language from the past, on the value equation. What does it really mean? How do we get to value-based health care from a volume-based fee-for-service, more of doing stuff, you get paid more sort of equation? And now we're going to have to do that because we simply don't have the money otherwise. What I think should be done is have Medicare lead, have some bold innovation come out of Medicare in terms of wrapping payment around value, not just outcomes and not just results, but getting rid of the overuse, getting rid of the underuse to make sure that health care is applied efficiently and directly. It means we got to change things radically in terms of how they're done. We need better information technology. We need more transparency. We need more accountability. We need government. We need a heavy dose of government to make sure there's a level playing field. If we do that, I believe we can keep an individual mandate. We can keep an employer mandate. We can have universal coverage, but we've got to adopt that transparency, those market-based principles, and make the markets really work. Some people think it won't work. I believe it will work. I've seen an element of that competition in markets work in the Medicare Part D prescription drug, this move to generics, this opportunity to choose, this opportunity to get out and select a plan that meets your own needs. We need to apply that a little bit more, and I think that we can do that. My goal is to see that the Obama's initiative that really is a product of the Congress work. It can't work on the timetable that we had planned, that he had planned, that the administration had planned, and that Congress had agreed to. It's nobody's fault. It's simply the economy itself can't support an additional $1 trillion at this point. I'm spending a lot of time with governors, Democrat and Republican governors, who simply say, to balance my budget, the competition between health care with the new burdens that are placed, and I think they're good burdens that are placed, but the burdens that are placed with security and with education. I can probably do it eventually, but I'm going to have to go at a slower pace, and that slower pace is what we, as America, I think are going to have to support and help our governors and our state legislatures determine at what rate they can adopt it.